Hello, my name is Dr. Rod Story. I'm a family physician in Moscow, Idaho. I often get questions from patients regarding health issues, and the most recent one that I've been getting a lot is about COVID-19 vaccination and children. Some of that comes that the FDA, and here's a newspaper report about it, has cleared kids for COVID vaccination, ages 12 to 15. In fact, they've even taken the step now of advising it. I think it's actually at the leading edge of a move to expand that down to children as young as age 5. I also think that there's a growing push to mandate these vaccines before children return from summer vacation back to school in the fall. We've seen that already at Washington State University with a mandate. I don't share the enthusiasm that I see of some of my colleagues. In fact, I have great hesitancy with taking this approach, and I want to explain why. Let me first offer some context, and then I'll address some concerns that I think are well-founded. First off, we really are in a unique spot. We're about 16 months into this pandemic, and we're seeing month after month rapid declines in the number of patients who are sick with COVID-19, who are being admitted to the hospital, and who are dying of COVID-19. This illness seems to be rapidly leaving our communities in the United States, and I think it is very clear why that is occurring. First off, as of the beginning of this year, we already had a large number of people in the United States who had encountered COVID illness naturally, who had gone through the illness, who had recovered, and now have lasting natural immunity to COVID-19. And there's a number of studies out there showing antibody response and excellent immunity after people encounter it naturally. When you add to that large group of people a now growing number of people who are choosing to receive the COVID-19 vaccine, you have what's developing is natural herd immunity. And that is remarkable. It's a game changer. I think what's particularly notable about that is that COVID-19 vaccination has been almost entirely a voluntary effort. Widely available in the United States, easily gotten at almost any pharmacy, really available for people to individually assess their risk and then to decide on their own whether they should receive it or not. In our community, we've had more than 50% of adults receive that COVID-19 vaccine, and I think that is really reassuring. That's a great way for people to ultimately decide how to address this concern and move forward rather than mandating it. So when you have that, what appears to be us on the tail end of it, and I think even the CDC would agree that, boy, we can throw off the masks and we can begin moving to outdoor activities, and I think many of us have already taken steps to move forward with life and work and school. We now are in an interesting spot where the conversation is about expanding and even mandating vaccination to the rest of our population, people who are likely at low risk. Let me talk more about that. First off, we have an amazing amount of data, and we've known actually from the very beginning, but it certainly has held throughout as we've watched COVID-19 move throughout the United States and the world, that we know that there are individuals that will get very sick with this, and we know that there are individuals that will not get sick with this. Almost unheard of that they will have any risks or long-term effects from that. Who is that? Well, by and large, it's children, teenagers, and young adults. We also know that these are the groups of people that are not likely to transmit, carry, or pass these illnesses. And in places that have gone back to school early, they've not noticed significant changes in the number of kids or exposures to at-risk adults from those communities. It's a remarkable thing that we have this data now. It's very, very reassuring. But we're talking about now taking vaccination, which is an active effect, an active measure, and taking it to a population that, if they were to have a passive effect of getting the illness, would likely not have a high risk from this illness, minimal risk, and I don't use that in a cavalier fashion, but for whom we are now encouraging or even considering mandating a vaccine. These are vaccines that are not, and that would be my second point, these are not weak vaccines. These are some of the most potent vaccines that have ever been produced for humans. Remarkable. We have data that shows that even one dose of the vaccine in most individuals creates lasting immunity. What we're talking about not moving from a voluntary situation to mandating and broadly giving it to children. And these are a concern. Why is it a concern? Well, I think in a couple of ways. First off, you have to make sure that the risks of benefits and the risks of vaccination and the benefits of vaccination far outweigh each other. When it comes to those high-risk individuals, it certainly is a consideration that the risk of vaccination, which is real, they're small but real, is much lower than the risk of having the illness. But in children, that equation is way out of balance, particularly when we start expanding it to a large group of people in a large population. We also have to consider that these are effects that carrying a potent effect on the immunity will be carried the remainder of a person's life. When you're a young person, and we acknowledge this in other areas of medicine when it comes to chemotherapy, when it particularly comes to exposing large amounts of radiation at young ages, that's an effect that's carried the remainder of their life. Now we're talking about really charging up the immune system with a vaccine for someone who's likely already going to recover without any challenges or concerns. I think there's a third concern. We know that almost every kid that has COVID-19 is going to have minimal symptoms. We know that. We're going to recover, often not even getting tested because their parents never would have suspected that they were ill in the first place. Very brief symptoms and very quick recovery. And that's amazing to think about. But then we're talking about giving a potent vaccine to individuals that likely already have natural immunity. We've never done this in such short order where someone who is already exposed and developed natural immunity now boost their immunity and really push them to new levels of COVID reaction. There's some interesting data that's still early on that shows that individuals who are already naturally immune develop 10 times the amount of antibodies after just one dose of the vaccine, way more than even naive individuals that get the vaccine. That's a lot of immunity. It's a bit like kicking a beehive over and over again and hoping that you don't get stung. So really we're talking about moving from a voluntary situation, which has worked by and large, to an involuntary mandated circumstance. We're talking about taking something that has benefited those at risk and now extending it to those that are not at risk. And we're talking about taking something that is potent, that we don't have any long-term data on, and extending it to children who will carry that response in their immune system for the remainder of their lives. I'm greatly hesitant at this, and I would encourage you to be very hesitant as well. And also, for us all to, again, take the approach that this should be best done voluntarily with parents that are well informed on an individual basis in discussion with your parents and your family rather than on a mandated level. Thank you. This is Dr. Rod Story.